Um, I would like to begin by acknowledging the traditional custodians of the lands from which we are all joining today. I join you from the lands of the Kombu-Meri people, and I pay my respects to their elders, past, present, and emerging. If you would like to share the lands from which you're joining today, or just give a bit of an introduction of yourselves, feel free to use the chat function. I am Dr. Michelle Shahid from the Prevention Center. And for those of you who are new to the center and this network, just a brief overview that we are a national organization with a vision for an effective, efficient, and equitable system for chronic disease prevention. And we do this in three key ways: by accelerating the use of knowledge, by building system leadership, and by incubating and driving new knowledge. So the Emerging Leaders Network is an important part of this strategy because it offers capability building opportunities for early and mid-career researchers, policymakers, and practitioners who are working in prevention across Australia. You can find out more about the network on our website as well. So this webinar today will be presenting findings from our recently released knowledge synthesis of implementation research, which was produced by the Prevention Center and Collaboration for Enhanced Research Impact, and it was led by the National Center of Implementation Science. The reason this came about is because we know that the potential benefits of prevention efforts are often impeded by implementation challenges such as lack of resources, inadequate delivery infrastructure, and limited workforce capacity. So we used our novel knowledge synthesis approach, which combined public health evidence with policy experience and communication expertise to tease out the policy relevant implications of implementation research from the work of the Prevention Center and several members of CERI. So our guest speakers today who will take us through these findings and the knowledge synthesis are Associate Professor Nicole Nathan, who is an NHMRC investigator at the University of Newcastle and a health service manager with Hunter New England Population Health. She is the director of the Population Health Program within Hunter Medical Research Institute and a research lead for sustainability science at the National Center of Implementation Science with over 20 years of experience. We also have Associate Professor Rachel Sutherland, who is an MRFF Investigator Fellow with the University of Newcastle's School of Medicine and Public Health. Her work is focused on the development and evaluation of implementation research interventions to scale up population health services. She is also an experienced public health nutritionist, health promotion practitioner, and program manager who has worked in this field for more than 15 years. Lastly, we have Elizabeth King, who, as the manager of the Skin Cancer Prevention Unit at Cancer Council New South Wales, leads a team focused on reducing skin cancer incidence through strategic policy settings and stakeholder engagement. She has more than 25 years experience working across a variety of public health content areas and is a passionate collaborator focused on improved program delivery. So welcome to all our speakers. Thank you for joining us today. So Nicole and Rachel will speak first towards the findings and the research element of this knowledge synthesis, and then Elizabeth will provide us a policy perspective. So just to remind you all that the session is being recorded, and this recording will be shared with the registrants today at a later stage, and we'll also have an opportunity for a question and answer session in the end. So keep an eye out for that. And without further ado, I'll hand it over to Nicole, and who'll kick off the presentation. So thank you, Nicole.
Thanks, Michelle. Before I begin, I'd like to acknowledge that we're meeting on Aboriginal lands. For me here in Newcastle, it's the beautiful Awabakal land, and pay my respects to elders past, present and emerging, and acknowledge any Aboriginal and Torres Strait Islander colleagues we have online with us today. Next slide. Thanks, Rach. Also, I'd like to acknowledge all the amazing partnerships that is a part of TAPC and have supported the research or the policy dialogue that we've undertaken. Thanks, Rach. So we're really, I'll get to that. We're really grateful to be given this opportunity to present the findings of our policy dialogue, and really thrilled that there's been so much interest in and people joining us today. So I'm going to give you a very brief background to implementation science and why we should care about it. Rach is then going to talk about partnerships and scaling up, and then we'll jump back to me to talk about sustainability, and then Liz will be giving some applied, I guess, understanding or context of this. And given we only have kind of 30 minutes or so, it will be a very kind of flyby presentation of the report. So please feel free to reach out to us if there's anything that you wanted to, chat more about. We'd be more than happy to. So in terms of chronic disease, so very briefly, we know that chronic diseases place a huge burden on our society. It's estimated that nearly half of all Australians are currently living with a chronic disease like cardiovascular disease, cancers, or type 2 diabetes. Thanks, Rach. Next slide. And sorry, and I should also acknowledge, I just want to acknowledge that the slides, some of these slides have been developed by our students and postdocs, so acknowledging their work here. I think what's really, I guess, shocking is that much of this burden could actually be prevented if we simply implemented interventions that already exist. There's research that shows that 50% of all cancers could be prevented if interventions that we currently have were routinely implemented, but they're not, and that's just, shocking. So, but what's happening is we continue to invest in the development of new interventions. And then what is missing is the evidence to support health agencies understand how to implement, what works, what the evidence-based interventions. So, for example, if you look at this graph here on the right, you can see that, kind of between 2000 and 2017, the cumulative number of randomised controlled trials testing evidence-based interventions in schools for obesity prevention absolutely skyrocketed. However, the grey bars are the number of RCTs testing how do we actually get these interventions implemented. And a bibliographic review that Luke Woofenden undertook found that only around 2% of public health research output were randomised trials testing strategies to implement these programs. Next slide, thanks, Rach. And so what this means is that the research translation pipeline is very, very slow. And I'm sure that, you've heard of this before, but there's been studies that have undertaken that have found that from the time that a landmark publication was published with an effective innovation to the time that it was adopted or translated into practice or clinical guidelines, it's on average 17 years. And I think what's also, really deeply concerning for us is that it's only then a small proportion of the research which is translated. So it takes about 17 years for us to translate just 14% of our research. And so at this pace, we're never going to address chronic disease. Next slide. Thanks, Rach. Has that moved on? Did that slide move, Rach?
Yes, it did at my end.
Okay, it's just slow here. And so for policymakers and practitioners, what we need is we don't just need to know what the evidence-based intervention is that we should be implementing. We also need to know how to implement those EBIs. Next slide, thanks, Rach. And so this is what implementation science is about. It's the study of methods and strategies aimed at promoting the adoption of the integration of evidence-based or effective evidence-based interventions into routine policy or practice, with the ultimate goal of improving health. And so implementation science is not merely about carrying out the implementation of an intervention. It is actually a science, and it's studying the methods and strategies about how we should do this to move these interventions into everyday practice. And so I'm sure you've probably seen this slide before, but I love it. I think it's a really simple way of understanding around, how do we get the thing, which is the EBI, and understanding the how of how we actually implement that. Next slide, thanks, Rach. And so our team within the National Centre of Implementation Science, in partnership with TAPSI and a number of other CREs, have been leading a lot of work for a long time around implementation science. And this is what led us, I guess, to undertake this knowledge synthesis, which we're presenting on today. And for those who haven't seen the report, it's downloadable from the website. So, Rach, I think I'll hand back to you now.
Great. So thanks, Nick. So now we have an understanding of the benefits of implementation research and the impact that it can have on the outcomes of prevention programs. One of the key questions that we explored through this policy dialogue process was the evidence for different workforce or partnership approaches to improve the use of research to enhance implementation of prevention programs. And what we identified is that partnerships between academia and policy agencies really occur on a continuum. From one end of the spectrum, research can be completely academically controlled. So where an academic or a researcher identifies the research question and then goes on and explores, I guess, the outcomes and generates the research. Right at the other end of the spectrum, it's policy controlled. So where a policy unit might identify its own research needs and conduct that research. But I guess what we really identified through this evidence synthesis was that where it's most effective is where there are those policy practice partnerships. And so partnerships between researchers and policy agencies really led to greater implementation of programs, but then that led on to greater impact on chronic disease outcomes or behaviours that lead to chronic disease. So I guess the evidence synthesis identified that when policymakers and academics work together to co-create and that the questions that they answer are policy-led is where we see the best impact on chronic disease prevention. There were also a number of strategies that were identified through the literature that can, I guess, enhance the impact of policy agencies and academics working together for dual benefit. So some of these strategies included things like conducting research training and capacity building with academics and policy agencies together. It could be at one end of the spectrum where researchers are actually embedded in policy agencies to identify, I guess, research questions that were of dual benefit and to carry that research out. They could be formal research practice partnership structures where I guess there's opportunities to formally draw on the expertise from both agencies. There could be formal networks or community of practice established where these types of agencies are able to get together on a regular basis and share experience. There could be things like agency leadership, commitment, accountability for research. Organisations can also offer incentives to use and reward research, and that's formal, I guess, resources and research infrastructure can also be embedded into policy or service delivery agencies to enhance the use of implementation research. So these types of research practice partnerships are really important, whether they be formal and embedded or whether they be more of a consultancy type approach. But I think one of the things I wanted to call out is how imperative these types of research practice partnerships are, particularly in the process of scaling up. And so one of the questions that we answered through the policy dialogue was how do we enhance scale up research, and how do we make sure that when we scale up, programs are still effective, they can be adapted to the local context, but they can also address the needs of priority populations. And I guess that's the million-dollar question that we would all love to be answered. So formally, scale up is a process which is known as a deliberate effort to increase the impact of successfully tested interventions. So that implies that we're starting with something that we know that is evidence-based and works, and then scale up occurs following that process. So what we know is that there is considerable challenges with scale up, to the point where our research indicates that we get at least a 25 to 50% reduction in the effect size when we scale up. So understanding how we scale up well can really impact on this and make sure that that voltage drop is minimised. But what we know is that that voltage drop is often as a result of the adaptations that we need to make to programs from a research context to get that into, I guess, a real world or service delivery context. And so we need to be really, I guess, purposeful when we're selecting the programs that we're going to scale up, but also in the process that we use to scale up an evidence-based program. And as Nick alluded to, the National Centre of Implementation Science, along with a number of the other CREs, have been working really hard with this scale-up process and how we can generate more evidence to ensure that we do this effectively. But I just wanted to call out a number of processes or key considerations that we could be making as researchers and policy agencies to ensure that our scale-up efforts are the most effective that they can be. So they start right at the very beginning when we're actually identifying the type of program, policy or practice that we'd like to scale up. And as I said, it needs to be evidence-based. But not only does it need to be evidence-based, we need to make sure that that evidence, I guess, is generalisable and it's had an impact on a number of different subgroups. So we don't want to be choosing an intervention that can only impact on a certain population group, and when it goes to scale, it may be causing harm. So that early research and identifying subgroup impacts are really important. We also need to make sure that the intervention is scalable, and that, I guess, calls out a number of the attributes of the intervention, but also the environment that it's going to be implemented in that we need to assess. And there are some amazing tools that have been funded by the Prevention Centre and led by Andrew Malat and team, where an intervention scalability assessment tool has been developed. And that's really a tool that you should be using with, I guess, in partnership between academics and also policymakers to really assess those intervention characteristics and the environment that you're going to scale up that intervention in to see whether it's suitable. And so not all effective interventions are actually suitable to go to scale. I think for us that the challenge is that often the scalability attributes are not often published, and that's why it's really important to do this process, I guess, in partnership with the agencies that are going to be responsible for carrying this out, but also the end users it's going to impact on. And just to call out that the National Centre of Implementation Science in the last couple of years has done a comprehensive scalability assessment on a range of interventions that could be implemented in schools and childcare centres that will be published soon. The next types of processes, once we've got an effective intervention and we're sure that it could be scaled, is around what are we going to scale and why. And I guess this part is really critical, and for me, I see it as the core reason why many of our scale-up processes currently fail, is we don't spend enough time doing this part in the centre. And that's really like using a scale-up framework. There are a number of those available, but really understanding the intervention components and the implementation approach and identifying what's core and what's not core. And so this is really critical. We need to understand the core components because these are the things in our intervention that drive the intervention effect. And if we go ahead and adapt these, then we're likely to be removing the very part of the intervention that is likely to cause change. But we can adapt things that are non-core, and these are things like the delivery format, the colours that we use, the language, etc., that could actually make it increase its reach or more suitable for broader populations. So be very purposeful in what you adapt and why. Again, some of the challenges are that we often don't know the core and non-core components. And again, I really encourage you to form partnerships with both policy agencies and academics to do this process in partnership so that that bit can be done really well prior to your scale-up effort. I'll go on to talk about barriers and facilitators because this really, I guess, gets to the crux of how we actually ensure that scale up is appropriate to our local context. At the core of scaling up and developing an approach or strategies to scale up is really identifying strategies and processes that address the core barriers and facilitators to adopting and implementing programs. And so we need a really good understanding of what the barriers and facilitators are. We can use lots of processes to understand those, and they can be things like reviews, surveys, qualitative interviews with different stakeholders, but also drawing on our own internal expertise at different agencies. We can then take those barriers and facilitators and map them to different frameworks that can help us identify really effective strategies or processes that can be used to scale up. But the reason that we need to understand barriers and facilitators is that these actually change across population groups, across time, and also at different levels. So different system or local level barriers and facilitators exist. And in the scale up process, we need to be mindful and address those purposefully. I'll just give a quick example before we finish. A lunchbox program that we have been working on in New South Wales. We did a lot of work to identify that it was an effective program, and our next step was then to actually scale that up. But we faced many of the challenges that you also face in your organisation about how do we do this well and how do we make sure it's effective, adapted to local contexts, and we don't cause any inequities. So this is a program that's been scaled up across 11 local health districts in New South Wales, but also across a number of jurisdictions nationally. And what we're doing is across our 11 local health districts in New South Wales, we've looked at local context and we've looked at barriers and facilitators. And each of these 11 local health districts actually have a different approach to scale up. We're then generating a community of practice where the findings from each of the local health districts can come together and we can harmonise our evaluation methods to actually learn from this quickly. And I guess the reason that this is so, important and impactful is that we will quickly generate lots of evidence around different approaches to scaling up and how we adapt to local context, and ensuring at the same time that we're having beneficial outcomes or equitable outcomes for everybody. Finally, before I finish, I just wanted to point out, the importance of monitoring and ensuring that we continually optimise our approach to scale up. We're not able to, continue to do the one-size-fits-all approach over multiple years and expect to have an impact. We need to continue to, call out, monitor where we're up to, look at new barriers and adapt our approach. I'll hand over to Nick now to talk about how we might think about sustainability once we've scaled up programs.
Thanks, Rach. So sustainability was one of the real, core questions that emerged from our policy dialogue. And much of what I'm going to say really probably echoes what Rach has already spoken about in Scale Up. So you'll see that there's lots of similarities. So Rach, if you could just go to the next slide, please. Sorry, and I think there's a delay on mine.
Yeah, so sorry, I'm currently frozen, so.
Your mouse is moving, but.
Yes, my mouse is moving, but nothing else is.
That's okay, I can talk. So when I
stop sharing and start again.
Okay. So when it comes to sustainability research, there are a number of terms that are used in the field. So, you might have heard things like maintenance and continuation or institutionalisation. And this actually makes it really difficult to understand how researchers or practitioners are operationalising and measuring sustainability. And so to address this, there have been a number of published definitions around sustainability. I'm forgetting where I'm at. And I think the one that has gained the most traction in the field is a definition by Moore and colleagues. I'll just see if Rach can get that.
So sorry, Nick, can you see my slides?
No, I can't.
Okay.
And I'm sorry, I don't have.
Would you like me to try and share?
Oh, there it is.
It's up, yeah.
It's up. You can stay in that mode if it's easier, Rach, if it's going to crash it. So the Moore definition, and again, credit to my student here for putting these slides together. So Moore's definition acknowledges that after a defined period of time, and so that's what we want people to say when we're talking about sustainability, we mean 2 years, 5 years, 10 years, that the program or intervention or implementation strategies continue to be delivered, and or it could be about sustaining individual behaviour change for other clinicians or the patients, and acknowledging that adaptation or evolution may occur while it's still producing benefits for individuals. Can you go to the next slide, please, Rach? Has that moved?
At my end, yes.
Okay, that's there for me. So why is sustainability such a concern? So a number of systematic reviews have found that only around 20% or 23% of evidence-based interventions are sustained 2 years after initial implementation. And so this not only wastes the billions of dollars that we're investing in the initial design, implementation, and then scale up of these EBIs, it also means that we really lose community trust, because if we keep going back to communities with new interventions that we want to implement, they're not going to believe that we're going to be there to see it through. Next slide, please. But in terms of public health, when we fail to sustain these evidence-based programs, any potential impact they may have had would be lost. So we know that some of these health behaviours that we're trying to change are really complex, and they can take years, if not decades, to change. And so if programs stop prematurely, then any potential benefit of those programs is lost. Next slide, please, Rach. So as a result, sustainability has been coined one of the most significant translational research problems of our time. And when we started on our path, research into sustainability, there's actually very little research done in the area. So a bibliographic review that we undertook found that only around 1% of research is actually focused on sustainability. And of those, there's only one study that was actually trying to test the effect of strategies to sustain an EBI. Thanks, Rach. So with such little evidence to go on, so what do we recommend for those who are looking to sustain EBIs? So the first important, I guess, takeaway is to plan for sustainability from the beginning, and this really resonates with what Rach was talking about in terms of scalability. Sustainability is often thought about, it's viewed as the final stage within an implementation, but the decisions that you make in the planning phase are likely to have impact on whether something can be sustained. So, for example, if you select a complex evidence-based intervention, or you don't have the resources to provide ongoing support for an EBI that may need it, it's unlikely that it'll sustain when we walk away. We've actually just published a typology of approaches which may be really helpful for people if they're starting to plan for sustainability from the beginning. And it's about the different approaches that we can use as practitioners or policymakers. And so we think there's actually 3 ways that approaches that we could use to sustain EBIs, and that's do nothing. So once after implementation, we don't do anything, which means you're really going to need an EBI that can be self-sustaining, that when you walk away, that it'll run without any ongoing support. Or the alternative is to provide some support, and that might be static support where forever and a day you're happy to provide resources, and that could be simply on websites, or there might be telephone support. Or you might adopt a more dynamic approach, and that's where your support and your strategies evolve over time as the EBI evolves or the evidence base changes. Thanks, Rach. If you can go to the next slide, please. So then once you know what approach you're going to use, we recommend that you identify the factors or the determinants which are going to impact on the sustainment of your EBI. And again, echoing what Rach has said in Scale Up. There are a number of theories and frameworks and tools which can help you do that, to help identify the determinants. And the 2 most prominent, I guess, that we kind of draw on a lot are the Dynamic Sustainability Framework, which was developed by Chambers and colleagues, is on the left, and the Integrated Sustainability Framework, which was developed by Rachel Shelton and colleagues, and that's there on the right. And again, happy to talk people through those if there's any questions around using theoretical frameworks. Next slide, please. there are also already a number of reviews which can help people identify determinants. So they've looked at barriers to sustaining evidence-based interventions in a range of settings, and so that's also a good place to start. Next slide, thanks, Rach. There are also a number of tools that you can use. So in the policy document, we've listed these tools. And they can help you identify elements that might be at risk for your EBI. So here I've got an example of the PSAT, the Program Sustainability Assessment Tool, which was developed by Doug Luke. It takes you through a set of about 40 questions around these 8 domains. You end up with a score, and again, it can help identify maybe some areas, at-risk areas for the sustainment of your program. Next slide, thanks, Rach. And so I guess our next advice is, once you know the determinants of an evidence-based intervention, we then recommend you that you apply the same processes of what you would within an implementation science, and that's to help you select strategies that might be most likely to address those determinants. Again, in the policy dialogue, we have this tool, but we do have other tools that we're happy to share that can actually step you through this a little bit more systematically. But basically, what the process is to map those determinants to a theoretical framework to identify potential strategies. We then recommend that you would do a process where you, with partners and end users, to assess the acceptability, feasibility, appropriateness of those strategies. And then, and very importantly, we ask that you describe those strategies consistently. So I think it's on the next slide, Rach, please. We have developed a sustainment explicit glossary, which will describe these strategies in more detail. And the reason we ask that the field starts doing this, implementation science was plagued with people using different words to describe the same strategies, or vice versa. And so it made it really hard as a field to move forward and identify, well, what, in synthesis, what were the most effective strategies. And so we're hoping that, if we can do it well from the start, that we'll rapidly inform the field more quickly than within implementation science about what strategies are going to be most effective. Next slide, please, Rach. And so I previously said that there was only one published study, but we know that there are actually a lot coming. So a scan of the trial registries, there are people who are already in the field undertaking sustainability trials. These are examples of things that we're leading. And so we're hoping that within the next kind of 3 to so years that we will have evidence on the effectiveness of strategies. And so I think next slide, Rach. Oh, mine hasn't moved on. There, yeah. And so finally, I guess our last advice is around monitoring the implementation of these evidence-based interventions. It's really important. I mean, it can be as complex or as simple as you want, but it's really important that we do monitor these, because it'll allow for identification of issues early. So if we know that implementation of an EBI is starting to slip, then you may be able to kind of jump in and provide some booster support, rather than letting it drop away completely and then having to, in a few years, pick back up and re-implement the programs and face, I guess, all those initial implementation barriers again. And, for some, there are great examples of monitoring system. New South Wales Health have had FIMS that have helped the Live Life Well at School, or the HCI program, for a number of years. And so there are examples of monitoring systems, and we're currently undertaking an evidence synthesis, or a scoping review for the WHO about monitoring systems and features, and so that would hopefully be published kind of in the middle of the year. So next slide, thanks, Rach. I think that's the end of it. Yes, so that's just our acknowledgement slide for the whole slide. And so we do want to acknowledge it has been fantastic. Some of these examples from the other CREs, please have a look at the report because there is great work happening across Australia. And thanks, Liz. I think that's you.
Thanks so much, Rachel and Nicole. You've covered so much in like 30 minutes. I can't believe it. So huge congrats to everyone involved. We just saw some of their names there. Oh, I've just gone dark. Sorry. I'm in a quiet room. So firstly, a big thanks for being invited here. I'm really delighted to be a part of it. And my job is to provide a practitioner perspective. And I did wonder why me? How did I get invited to speak? And if you go to the next slide, you might see why. It might build if you need to click on it again. So yeah, I sent an email to Helen in January, and for those of you who know me, I can get excited and effusive, but this was a professional email. But I really did say, without wanting to overstate it, reading this document feels like the most comprehensive summary of a holistic reflection on the challenges and strategies that we face in public health program and policy implementation I've ever read. And I really mean that. Like, I'm not overstating it. It is. It's dense, so I suppose my point is don't be intimidated by it. But I think I just wanted to call out, I've worked in public health for what feels like quite a long time. I wish I had have had this sort of thing earlier on in my career because it really takes out the guessing game of how do you join the dots. And I think that's the thing that's so important for us. We're all busy. We're trying to do better. We're managing the resources and the challenges that we face in our work. And this is a guide that I really encourage you to keep handy and know that it will help you at any phase. I've got, as you'll see in a moment, I've got several programs or that are already in place, but we're really wanting to revisit them and reflect on our assumptions and try to do those better. So I think this is just calling out, this is important, and it's exciting to have such a collaborative group of academics that are taking this implementation science and really going, how do we fix it? And we know why we're doing this because we know that too many evidence-based interventions fail, and we really want to do our part to realise the potential. So moving to the next slide, what impressed me about this report was firstly its process. Again, I think this slide might build. Sorry, I wasn't sure. I shouldn't have done it. If you could just click again. We've got expert consensus feeding into the two parts of a policy dialogue with which I think was a really important part of, there's all these experts, then they've gone out to say what's relevant, brought it back and done a really great evidence gathering and synthesis. So I only had a very small part to play, but I was just really delighted to see this as a process. And the second point I wanted to make, the specific advice and tools regarding the management of really relevant implementation issues are emerging. Some of them have been around for a few years and I've tried out some of them, but to have them all in this step-by-step guide is so impressive. So in the next slide, the other thing that really impressed me was just trying to keep it simple and high level. So we've got these 4 priority meta themes, which we've just heard explained by Rachel and Nicole. And I just wanted to go through those one by one from how I see that as being relevant to the type of work that I do. And just to summarize, I'm a generalist. I've worked in policy areas, in program and service delivery, and right now with my role in skin cancer prevention, we're doing a lot of setting-based program work. So we really are thinking about how do you get this at the grassroots level and how do you apply these types of very important structured processes to getting that type of engagement in that setting base. So moving to the next slide. Firstly, what are useful workforce and partnership approaches? This is just taken from the summary page, which was at the start of each section. I think this is such a great question because the report identifies the different ways to do this, and it basically shows that we can adapt it to suit our organisation's style of working and their appetite for whether it's going to be policy-led or academic-led, and also the needs of our projects. And the key message that co-creation is the best really says to us we shouldn't be shy. We need to collaborate more. We need to manage up and ask our managers to see if we can do more of that, because while we might need to plan for that and have more time, we are going to get a better outcome. And I think this is so important. We can't just be saying, oh, here's our budget, here's our deadline, let's just do what we need to do that's right in front of us. We can do better, and we have these resources to help us do it better. The next slide was, how can we balance program fidelity, scaling up, and adaptability? Now, I found this so important because it's about balancing the relative priorities of the program fidelity itself. How do you manage scale up knowing that it's going to lose its impact and the challenges of that? And then how do you explore the program agility so that the program can be adapted to meet local needs? And that issue of core and non-core components is so relevant. We've got competing priorities here that we're wanting to navigate. And I think going through these various tools and the steps that are outlined there are really useful processes to keep in mind. And while I haven't used all of them, it is super exciting to see that we've got both the journal article references and the tools that we can take to that to apply it. The third area of how can the programs be sustained, this was so impressive. I really feel like this is a huge issue. And as one of the points that I think Nick made with respect to, that's where the real impact can be done when you sustain your programs. It's so important. And we know that we can see that decay in programs over time. And for us, one of our programs, we're having real problems in trying to keep that engagement up. And while we haven't done it yet, being able to go to this section and go, right, what's our process? How do we think about that? Conducting a sustainability assessment. What theories or frameworks could we apply to help us improve, and what considerations do we need? So this is an area that I know me and my colleagues will be going back to, because we see it as being such a relevant thing to what we're facing right now. And then moving on to the next question of how can information from the program lifecycle be used to inform program improvements? I think this is such a good reminder in terms of gathering and monitoring evaluation evidence across the program lifecycle. In relation to that first dot point, there's always new evidence emerging, and having a process to capture that, I think, is really important. We recently just commissioned a literature review for one of our programs, and we were actually quite surprised by the number of articles that our team wasn't aware of. And I think that's that idea of having a structured approach as well as balancing that with your general knowledge is an important part of this. And we've seen so many of the articles that have been referenced in this presentation, which will be so good for us to go back to and apply them to our work. And then in relation to the second and third dot points here, the use of multiple sources of data and aligning them to frameworks and strategies might sound quite obvious. But again, I think what's really great about this document is it helps support the process of making sure we don't deprioritize the importance of data synthesis and strategic framework reflections. And I think a key point here too is we're not going to do all these things quickly. They're going to take time. So you might be ruminating and coming back to them and thinking, yeah, that's really important, but I'm the reason. It just gives us the map. And I think this kind of mapping process is so useful. So moving on to the next line, how will I plan to apply this to the work that I do? So in New South Wales, we have a skin cancer prevention strategic context that's driven by the Cancer Institute. And we're really fortunate to have this because it's an evidence-informed strategy enabled by broad consultation and stakeholder engagement. And the goals and the guiding principles can be easily cross-referenced to an implementation guide like the Knowledge Synthesis Report. And if you move to the next slide, just thinking about what Cancer Council New South Wales does in this space, we have 4 priority settings in the area of education, recreation, sport, and workplaces. And while this was very much a mad map of me going through the considerations for improved implementation that were in this document, what I've just done here is, the green tick is what we're currently doing. The red cross is where we're not doing it, and we might think we have good reason for not doing that right now. But the light bulb idea image is really all of the ideas that have come to mind to me in thinking about this report and thinking about how we could apply it to the work that I'm currently doing with my colleagues here at Cancer Council. So I see it as it's a lot of things to think about. I don't expect that we'll be doing them all straight away, but just having them in our back pocket to know we can do better and we've got a pathway to help us do that, I think is really important. And so this next slide is my last slide. And it does build. I didn't realize. If you could just click it a few more times. I just wanted to highlight three things that stuck with me when I was thinking about this, is that we shouldn't leave this work to the implementation scientists. And sometimes we can think, oh, look, it's quite complicated. But I think it's important for us to lean in, know that this is building our capacity, and committing to a continuous improvement approach is going to be better for everyone. And a values-based statement, which is quite a big one there. But the health of the nation can really benefit from the work that we do, and we shouldn't forget that. That's why we're all here, and that's why we're passionate about this. So I think this is, we might look at setting up communities of practice or thinking about how we can keep this alive. And I really encourage everyone to think about that. My second key takeout was just this idea of we don't have to take it too seriously and feel like the weight of public health sits on our shoulders. I just wanted to think about this. We can be playful with it. We don't have to have all the answers, but it doesn't mean that we should think that it's too hard. I think it's an important part of that leaning in. And my third takeaway was thinking about this as a really organic process, that, okay, we have the guidance and the tools, but the key part of it is getting our hands dirty. And this quote I saw recently on LinkedIn, and I just thought it was a really nice way of thinking about it. Is the art and the science of what we do, and we are leaving a legacy for those who work with us and those who work with us in the future with the programs that we do, to really take this area of work further and think about how we can broaden and build the impact that we can make. So that's me.
Thank you, Liz. Thank you, Rachel. And thank you, Nicole. That was such an insightful and wonderful presentation. The knowledge synthesis and the report itself is such a mammoth effort. And I'll quote Liz here, but the presentation was also a very comprehensive summary without overstating it. And I think you all explained really beautifully to us all, keeping it, relatable and easy to understand. So thank you for that. I will open the floor to questions now. If you or any of you has any questions, or if you're feeling brave, you can pop them in the chat, or just use your mic or camera and you can ask any of our speakers. All right, so Nikki has her hand raised. So yes, Nikki, please go ahead.
Hi, everybody. Thanks for that presentation. I was very happy to be part of the dialogue and to see today the results. I work with Liz, and I just thought it might be good to talk, Liz, about programs that Cancer Council run, the example of SunSmart and how long it's been going. So it's 20 years in New South Wales, roughly. And how do you keep the fidelity of what's always been there, what's known, and try and stop that feeling of staleness, or the job's done, or people think that SunSmart is no hat, no play. They always bring it up. They think it's universal. They think it's a rule. It's not at all the full extent of what SunSmart is. And how do you take that forward as you keep wanting to enhance that program using these new resources?
Look, thanks, Nikki. It's so interesting because when we've been doing quite a bit of work, and some of the authors of this report are people that we've spoken to about SunSmart, and they often talk to the fact that they think SunSmart is a relatively sticky program in schools. We know it's so hard to reach schools. And the thing that I think is super relevant here is that there's a whole bunch of tools that we're going to be able to use and that we're planning to use as part of a process of revisiting SunSmart and thinking about how we can do it better. But if I just go to the language that we often use in terms of the issues that we face with schools, is that we have done quote unquote research to show that they think the job is done. And when you think about contemporary challenges that schools face, there are so many, and just thinking about the discretionary programs that might relate to all of the health and well-being of students, we don't have the same salience and priority. And potentially you could argue for good reasons, there's a whole bunch of new challenges that children are facing and parents have ranked as their highest concerns. And so one of the things we're wanting to do is just lift the why it's so important and why schools are important, lift the issue of the fact that what they need to do is more than just know how to play in the shade, and also lift that how. And so we've been thinking about policy implementation support tools for a while and wanting to develop that. But what's really great about this knowledge synthesis report is it gives us the tools of the real how do you do it? Because I think so much of this is that challenge of how. But I think the other point that I'll make, just to wrap this up, because I could talk for ages and I don't want to take over too much of the time here, but that idea of the partnerships and getting inside the setting and really understanding what's important to them and making what we do fit, whether it's their prioritization in the education sector, whether it's the language they use. One of our goals is to be sun safety you do while you're doing something else, because we know that the fun stuff isn't necessarily the sun safe stuff. You just want to make that the foundational piece of thinking. And I think the real challenge that we have is we don't have some of the legislative and regulatory levers that you might have in other areas of public health. And so we are looking at this from that perspective of how do we achieve culture change within a setting when it is such a packed space. We know that everyone's trying to influence the education sector, and post-COVID, they've had so many challenges. So we're in this for the long game, but I think that having a process through the implementation guidance that we've got here, and understanding that we need to know our audiences and know our opportunities in those audiences. And be digital. We need to be 21st century.
I might just add there too, Liz, like one of the, I mean, you mentioned that no hat, no play is a core component, but there are also many other components of the SunSmart policy, and being really clear of what the core components are, and ensuring that they're monitored and then implemented and is one thing, but it also allows schools to adapt and be flexible and to, I guess, really drive the other non-core components that they'd like to add to their SunSmart policies as well. And as we both talked about, Nick and I, both the scale-up process and the sustainability is dynamic. And so monitoring those barriers and facilitators and where they're at, the support that agencies provide over time will change. And so that will really, I guess, depend on where the sector is up to and what the challenges are that they're facing. But it doesn't have to be the same process for 20 years straight and look the same. It will adapt and change over time. And I guess that calls out the importance of monitoring and collecting that data to enable that to happen.
Indeed. And I think also thinking about the perspectives and drivers of the whole of school framework, and it might even be thinking about the incentivization. Like, we know that SunSmart is something that schools like to say that they're a part of, but often schools didn't know what SunSmart meant. And so we just got to be better at explaining what those core components are, enabling them to be able to do that in a way that could that suits that school setting, and also thinking about it in a real practical sense. Like, we often get so many concerned parents saying that they've just had their swimming carnival and there was an incidence of sunburn. Like, we have this policy that talks to behaviour, environment, curricula as the three themes, but we also feel it's really important to have the basics where it comes to that acute harm, because with skin cancer prevention, so much of it is the latency over time and preventing the harm for future. I think it really is dicing it up and thinking, how can we look at it from the school's point of view and their reputational risk, for example, if they have sunburnt kids at the end of an external outdoor outing.
Thank you, Liz. So we have another question in the chat from Helen. I'll just read it out. One of the key messages is that we need partnerships between researchers and policy agencies in order to improve implementation and have a greater impact on chronic disease. So where do you think we are with that in Australia, and what can be improved? So that I think that's to all of you.
I'm happy to start and feel free
Yeah.
to jump in. I think we've in Australia have made huge progress. I think there's much more recognition of the importance of implementation research in guiding, I guess, how effective our interventions are, but also at a policy level, how impactful they are on the community. So I think from my perspective, I can see massive changes in, I guess, the interest in this area. And then that leads to the partnerships. But I really liked what Liz said in her summary about being brave, for researchers to be brave, to make sure that they partner with policy agencies and make sure that we're answering questions that are actually relevant to them, but also for policy agencies and service delivery agencies to make sure that they're partnering with researchers and implementation scientists to help them answer questions and gather evidence and data that can then do that continuous improvement cycle. So I feel like we've moved a long way. I could be a little bit naive because I sit in a lovely policy practice partnership that's been operating particularly well for more than 20 years, but I can definitely see interest in moving in that direction. So Nick and Liz might want to add to that.
Yeah, no, I agree, Rach. And I think, I mean, for academics and researchers, funding schemes are definitely moving that way, where you have to demonstrate true collaboration, true co-design. And so I think, in the next few years, it's going to be absolutely imperative that we're working with our end users and our partners so that we are answering policy relevant questions. And so, hopefully it will be of the benefit for our community, because we're not distant. We are answering the needs of policymakers and practitioners. And I think even, when we've done small grant schemes, the issues that our practitioners or our clinicians identify, they are real problems, and they just need support with the implementation or the research around it. So I think if there's only academics on here, there is a world of clinicians and health promotion staff who are looking for partners to help.
And I might just say one thing to wrap that up. I think, sometimes people might think, oh, if I'm going to partner with an academic group, I'm going to have to be open to doing an RCT. And I think that kind of idea, I think you need to just push that to the side, because part of this is looking at what you're wanting to do and how you're wanting to get the best outcome. And if I think of examples that are real drivers for us, is that it's in our interest to know that when we go to report on something we've done, that we've had that sense check of the evidence and had that collaborative nature just to improve the quality of what we do. Sorry, of course it goes dark while I'm talking. And the other point is, we find in the kind of work that I do, having exemplars and case studies of being able to say, we did it here and it worked well, and this is why, even though we know it can be harder to replicate that, even having that as a starting point, we know that that's such an important part of being able to keep the narrative going and to snowball impact. So there's so many reasons I think that it's worthwhile doing this. And I think and to the point that I think there are so many benefits. Like, we're looking at working with a government agency on their outdoor workforce, and we're working with a university on that. And there's just the cross benefit of our subject matter expertise and their processes in that co-design with the organisation. So I really see it as a win-win.
I'm conscious of time. We have just 1 minute left, and we do have a question from Harriet in the chat. So what we'll do is, if everyone's happy, whoever wants to stay on will answer those last few questions. And for the rest of you who will be logging off, thank you for joining. And please keep an eye out on our socials and our website for future events. And you can also find information there on how to stay engaged with the Emerging Leaders Network. And we also have communities of practice on public health law, citizen science, and quality quantitative research. So we look forward to staying engaged with you over the rest of the year. But Harriet, if you are happy to ask, just turn on your mic and ask your question. Otherwise, I can read it out to the panel.
Sure. It was just a question around thinking about sustainability at scale. So moving away from just the doing of implementation, but that we're so trapped by political cycles and each government needing to create a legacy and not wanting to do what the previous government did, and things get defunded. And it's this constant trap that it's so difficult to get programs sustained beyond government. And just any thoughts on that and how we might even accommodate it if we can't solve it when we're planning for scaling up?
That's a great question, Harriet. And that's definitely something like we are trying to grapple with. Last year, we undertook qualitative surveys with every health agency across Australia, and this was something that came up. And they're very it's very acute for them if they're working directly with ministers. I think one of the things that emerged was really around that. Planning from sustainment from the beginning. So who is going to own this? Where is it going to sit? Does it have to be a self-sustaining intervention that something like, and Liz, I'm going to say it, but no hat, no play, but something that, we know that there's not going to be any ongoing support either at the end of the funding period or if governments change, but we think it's really worthwhile, then we might need to be designing EBIs from the get-go that resilient to that. I mean, nothing is probably, forever, but I think it's that. I mean, we are imagining it as the approaches from the beginning. If we think that forever and a day a government is never going to drop something like an immunisation program in schools, that they would never stop. Hopefully, never stop funding that. Then there's different strategies or different approaches that you might use, but. Yes, we think that it will come down to the selection of the EBI from the get-go.
Thanks, Nick.
I might just say something, if you like,
Yeah,
just
please.
on the Get Healthy service, which I believe has sustained changes in government. It was launched in 2009, and I was working at the Ministry of Health at the time that it launched. It was designed to have some sustainability elements, and the phone-based coaching was one of them, from the perspective of engagement and framing, because when you're showing up to community programs face to face, can be difficult and can reduce that scalability part of it. And not that it's my place to talk to this, but I know there have been publications on Get Healthy at Work and the challenges they have with scalability. And I think that idea of workplaces are hard, we know that. But so going in knowing that it won't be easy, but also going in knowing that you might be able to influence the mandate when there is a political imperative to do something, like that is always hard. It's even if you try to advocate up and influence, you're still only influencing those who are willing to listen. So I think at times all we can do is do our best and use the evidence and our development of the evidence, our creation of that, to prove that it's worthwhile staying committed to and trying to be resilient when you ride those waves that inevitably will happen with political buy-in.
Liz, for those insights. I think it's really important, as you, Rachel and Nicole mentioned, that it is a dynamic process. And once you do identify those barriers and challenges, it's not always a one-size-fits-all approach. So you have to, take that time to identify those changes you'll need to make when you scale it up, and even in terms of sustainability as well. So I think we've all learned a lot from this session, and it's been really valuable, and really excited for all of us to go and read this report and start implementing it in our work as well, and especially in those early stages of planning and developing those partnerships. I think it's very important. And if you're interested in reading more about the implementation research knowledge synthesis that the webinar was all about, you will find that on our website, and a link has also been shared in the chat. And yeah, if you have colleagues who would like to join our Emerging Leaders Network, please do ask them to do so and head to our website and get in touch with us. Even if you have more questions for us regarding this webinar, for anyone on our panel, feel free to get in touch with us afterwards as well, and you will receive a recording of this session. So thank you again so much, Rachel, Nicole, and Liz, for your time today and for presenting these extremely useful and wonderful findings. So thank you. And that's
Thanks,
a wrap.
everyone. Thanks.